Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my YouTube video channel. So I'm back with another adult NMC OSCE video for you again. So if you like my videos, please press the like button now and subscribe to my channel. Okay, so today's video, what we're going to talk about in today's video is going to be one of your another scenarios, because we've been covering some of the scenarios for assessment station. So today we're going to look at, because you've been all asking me for this, so we're going to look at the surgical scenario today. Okay, so how is surgical scenario different than any other scenario which can come in your exam? Okay, so don't skip the video and slides because we're going to, this is definitely different. Okay, surgical scenario is different, so go through the video and hopefully that it should help you. Okay, so I'm going to talk about a surgical scenario and what you need to do in your 20 minutes, and then what are the main nursing needs for this patient and how are you going to address them. Okay, so that's what we are going to look at. It is slightly different because your patient is going to theatre. Okay, so listen carefully and then hopefully this should help you. Okay, so let's get started. Oh, and also if you want to keep sending comments, please do so, because they do really help me to know what you want more, and also it's just good encouragement, isn't it, to just keep going and make these videos for you to help you with your OSCE revision. Okay, and we do provide full OSCE training online and face-to-face, and we have exceptional first-time pass rates. We are very proud of those pass rates. We do make you work hard, but you do get the pass first time. Okay, so if you do want to know more, just call us on the number or just email us on oscenustraining.com. So okay, so let's get started with this video today. So we're going to talk about the surgical scenario here. So the first slide on, so you already know that this is assessment station. It's a 20-minute station. You will be given a patient history form and you will read that within your 20 minutes. Okay, there is no extra time for reading. So as soon as your timer starts, the first thing you should do is have a look at your scenario, read it carefully. Okay, so that's the first thing. So you will get patient history form. As you can see, as an example, I have put in here a surgical scenario which is hernia repair, and this patient is elective admission, so they're going for elective hernia repair. So they've been admitted to go for hernia repair today. So that's what's happening. Okay, so you are the nurse who's going to be looking after and doing that admission on them. Okay, so that's the thing. You can see they are for hernia repair. The patient is feeling a bit anxious, which is quite normal, isn't it, before surgery. So that's the kind of scenario you may get in your exam. Okay, so next screen then. What do we need to do in 20 minutes? So let's keep it simple. We do need to take vitals because it is assessment station after all. So we will have to take vitals. We will have to complete the news chart correctly. We will also have to verbalize the monitoring frequency of the patient depending on the total news score and the escalation plan. So if this is the first video you're watching on assessment, please go and watch other videos I have done on assessment station and all about the news charting and everything. I will add the link of those videos to this video below. Okay, so there are lots of videos on assessment station, how to complete assessment and the news charting. So next one is that we have to conduct full A to E assessment, so airway, breathing, circulation, disability and exposure. So it's definitely need to be done for this patient as well, okay, as per your marking criteria. So there is A to E assessment video already done, so you can watch that. Now next is carry out the holistic assessment. So that's where it's slightly different because it's a pre-op patient. Okay, so we need to still look into patient physical, psychosocial, spiritual and sexual needs, and also because it's a pre-op scenario, we need to think about safe preparation for theatre as well. So that's what makes this scenario different than the other scenario, because we will have to think about the safe preparation. We will also have to think about what kind of things patient will have post-op and what will be the nursing needs. Okay, so we will have to think about that a little bit more, which we're going to talk about in a minute on the next screen, but that's what in few minutes on the screen, but that's how the this scenario is different because obviously your patient is going to theatre. So documents to complete is still a news chart. You are not given any other document. I hear a lot of rumors that you will have a different document, a pre-op checklist, this, that. No, the only document examiner still marks in this scenario is still the news chart. Okay, so don't listen to all other rumors. It's definitely just the news chart you need to complete for documentation. Now the holistic assessment, so that's the next screen. So that's what makes it interesting and different, this scenario, because it is a pre-op patient. So you need to talk about simple pre-op things like, has your patient signed a consent with the surgeon? Does your patient understand nil by mouth instruction, the fasting instructions? Normally 6 hours for food, 4 hours for fluid. They have to fast 4 before theatre. So do they understand that? Just the simple things like that. And do they understand the procedure, what they having done? Have they got any other questions before surgery? All their belongings are locked up, and all those simple things that they do understand. And also maybe thinking about their deep vein thrombosis. You can mention that you will do assessment for the deep vein thrombosis, because obviously surgery increases the risk of blood clots in the legs. So you can mention that. So those are the simple things that you can think about, and mention that in your scenario to your patient. Just ask them these simple questions. Okay. So what's the next thing then? The next thing is obviously, so if we think about now pain. So pain will be the next thing, and anxiety as well. So your patient is quite anxious. So talk to them and ask them what is the reason for their anxiety. Okay, why they are anxious? Is it because of the anesthetic? Is it actually they're worried about the pain post-op? Is it what's bothering them? Okay, depending on what answer you get from your patient, you can ask them, you can offer them to see the surgeon again, or the anesthetic team again. You can arrange a meeting, you can reassure them, you can calm them down. Okay, so that's important thing, because your patient may be quite anxious before theatre. Other things you can talk about with your patient is obviously pain. They are not in a huge amount of pain at the moment, but they will be in pain when they are post-op. Okay, so you're already preempting that problem, and because that might be the one thing they're worried about. So you're talking and reassuring them that they will be giving regular pain relief. You will be assessing their pain regularly using tool 0 to 10, 0 being no pain, 10 is the worst pain. You will be giving them pain relief. You will be changing their position regularly to keep them comfortable, so all those things. And if the pain is not, obviously, if they're still in pain after having the pain relief, if the pain is not getting better, of course you will inform the surgical team to come and review the patient. So you can reassure them that you will manage the pain accordingly. Also you can ask them to already practice some deep breathing exercises which they can use post-operatively to help with pain. Other thing is we will definitely think about the mobility. They will need help with mobilizing little bit for first few hours when they come back from theatre, because obviously they're going to be under the effect of anesthetic drugs, and they might feel dizzy getting out of the bed on their own. They will definitely need help. So you do need to mention that they need to press their bell, and anything they need, obviously you're going to help them with the mobilization until they are fit enough to mobilize, okay, themselves. And the other thing is, obviously we done the pain, we done the mobility, and the risk of wound infection, which is a big one for any surgical scenario. So you will talk about, you will monitor their wound regularly for any bleeding, any other signs of infection, and also their dressing will be done using aseptic non-touch technique, and that should prevent infection. And obviously you will keep the dressing dry and intact. Okay, that one. And then you still need to, of course, think about their family needs. Is there anybody they would like you to call when they come back from theatre? Would they like anybody visiting them into hospital after operation? Have they got any religious need? Would they like to pray before they go to theatre? And things like that. And sexual needs. Okay, so their preference, if they would like male or female carer for their personal hygiene or anything like that. So you can think about these things as well, which you do need to mention. You do need to have holistic assessment, so you need to think about and adapt it to your scenario. Okay. And of course, because it's a holistic assessment, so it's not just the physical needs of pain, mobility, risk of wound infection. You still need to talk about their family needs. You still need to cover, think about any religious support they may need, and also the sexual needs section. So that has to be completed because that is common to every scenario. So you still have to do that. So what's the difference? Means in summary, the difference is because it's a patient going to theatre, so it's the pre-op checks, and also thinking, preempting their nursing needs, what they will be post-operatively. Okay, because that's how you will do an admission on a real scenario in real practice. If you were admitting a patient for theatre, of course you're going to talk about their what they will be preempting the pain and all that, risk of wound infection. So you do need to talk about that. So hopefully this give you a clear guidance now how to go through a surgical scenario in your NMC OSCE exam, and just stay safe and not say anything which is going to be a negative. And make sure that you can do this safely. So I hope you like the video. So if you do like the video, please press the like button now and subscribe to my channel. You can also visit us on OSCEnursetraining.com or email us on OSCEnursetraining@outlook.com. I will soon be back with another video for you. So bye for now.